Hello, my name is Kristina Kusumareni. I'm BM Populasi ke-10026. I'm from Medical Faculty of Malahati University. And now, I want to tell you about special examination of COVID-19. To detect COVID-19, tests called PCR and rapid tests are needed. Both types of examination aims to determine whether a person is infected with the coronavirus or not. However, what is the difference between the two types of examination? If we have symptoms like cold, fever, and shortness of breath, it is advisable to immediately go to the hospital for a COVID-19 check. At the hospital, the doctor will carry out a physical examination and test whether we have had a contact with a person COVID-19 patient in the last 2 weeks. And then furthermore, the doctor will carry out supporting examination in the form of a rapid test and PCR to diagnose COVID-19. The PCR and rapid tests are used as a way to detect the coronavirus in the body. Therefore, for those who don't know about the PCR test and rapid test, here is a brief explanation. The PCR test is a type of examination to detect genetic patterns, DNA and RNA, of a cell, germ, and virus, including the coronavirus SARS-CoV-2. Until now, the PCR test is the test recommended by WHO or World Health Organization for diagnosing COVID-19. The level of accuracy of the PCR test is quite high, but this examination takes a long time to come out, which is about 1 until 7 days. Apart from COVID-19, the PCR test also used to detect several other viral infections. Apart from the PCR test, the rapid test is also often used as an initial examination or screening for COVID-19. As the name implies, the results of the rapid test can be immediately known in a short time, usually about a few minutes or at most 1 hour, to wait for the result on the examination to come out. Until now, therefore, are two examination types of rapid tests that can be used to detect the presence of the coronavirus in the patient's body, is namely antigen and antibody test. The rapid antigen for the coronavirus is carried out by taking a mucus sample from the nose or throat through a swab process. A more accurate result is necessary to carry out a rapid antigen test no later than 5 days the appearance of symptoms of COVID-19. Several studies have shown that the coronavirus antigen rapid test has a better accuracy than the antibody rapid test. However, the rapid antigen test is considered not as accurate as the PCR for test diagnose COVID-19. This type of rapid test for COVID-19 is the first type of rapid test to appear. Unfortunately, this test has a low level of accuracy in detecting the presence of the coronavirus in the body. This is why a rapid antibody test is not suitable as a testing method to diagnose COVID-19. Difference of PCR test, rapid antigen test, and antibody rapid test is: first, the result of the rapid test, both types of antigen and antibodies, take a fairly short time. It is about 30 until 60 minutes. Meanwhile, the PCR test procedure takes less least 1 day. Then, the most accurate supporting examination to detect the presence of the coronavirus is the PCR test with an accuracy rate of 80 until 90%, while the rapid antigen test has an accuracy level slightly below the PCR test. Antibody rapid test is an examination with the lowest level of accuracy, which is only about 18%. The sample used, the PCR and rapid test use mucus sample from the nose or through that are taken through a swab process. Unlike the rapid antigen test and PCR test, the antibody rapid test as a blood sample taken from the tip of a finger or blood vessel. Okay, I think it's enough. I'm sorry for my mistake. Thank you for your attention. Goodbye.